Hey guys, Ashley with Amare. So, few resources for you guys. We are located in Elizabeth and Highland Park, New Jersey, and I also offer virtual consults. So if you guys need my help, give the office a call, 732-841-0142, and our scheduling coordinator can help you get set up with an appointment. We also have our online shop. So all the products that I talk about in my videos, those are all in our online shop for you guys to purchase. On our Instagram, Amare Healing Arts is our Instagram. All the products are linked right there in our bio. Also, the online shop is linked, and it's linked in the description box for each video. So you guys can go and check those out. And then we have our online course school, the Post-Op Academy. So all of the things that you would need to know post-op, we are doing online courses for. So things like what kind of massages you need, when you need to get them, who to get them from, how to find a therapist like me, all of that we have online courses for. There are going to be more courses coming out all the time. So check in on that to see what's new and what you guys can learn. If you like my videos, all of those courses are exclusive content. All those videos are exclusive content. None of them are on YouTube. They're all in our courses. So that is amarehealingarts.teachable.com. The link for that is also in the description box, and it is also linked in our bio on Instagram. So I hope you guys enjoy the content. Ashley with Amare. I will see you soon. Bye.
Hey guys, it's Ashley with Amare, and today we're going to talk about web cording, axillary web cording. So we talk about all these post-surgery things, right? But a lot of times you guys forget post-surgery does not just mean plastic surgery. It also means knee surgery, shoulder surgery, breast cancer surgeries, all kinds of surgeries. All of these things that I share with you guys about plastic surgery are not exclusive to plastic surgery, and this is one of those things. So axillary web syndrome or cording, okay, what is it? We have a couple different resources here today that we're looking at, 3 of them actually. So the AlbertaHealthServices.ca, they have an actual PDF explaining axillary web syndrome, and they're a cancer care center. So let's get into it. So what is axillary web syndrome? Axillary web syndrome is also called cording, tethering, or banding. It is a condition that may happen in the arm, armpit, trunk, or breast after surgery and treatment for breast cancer. You may see thick or thin bands or cords in the armpit, which may run down the arm. Sometimes these cords can go all the way down to the thumb, which I have seen. There can often be some pain in the area of cording, making it difficult to reach, lift your arm, or straighten the elbow. What causes cording? The cause of cording is not really understood yet. We have medical journals that explain it that I'm going to get into. It may be caused by lymph, we know that word, or blood vessels that become inflamed after they are damaged by breast cancer surgery and cancer treatment radiation. Sometimes it can be caused by the cancer itself. So, one second, I'm going to move you guys to show you what it looks like. So that's what it looks like. That cord right there, that like thick band under the skin, that's what it looks like. And I'm going to show you another example. So this is web cording in the armpit, and this is a medical journal article. And it looks like these thick cords, and it can run all the way up in your arm. So that's what they look like, and they can be in this whole area. So let's go over this real quick. Thick or thin bands of cords from the armpit, which may run down the arm, sometimes all the way down to the thumb. So in the joints here, where the joints flex, you'll see like a thick guitar string almost, or like an actual cord, or like thick lines and bands that will stick out when you lift your armpit. You'll see them like you saw in the photo. They attach to your ribs, then they can run all the way up to your elbow, or they can just be in the axilla area. It's a wide range of this whole area being affected by those cords. So this can happen from a couple different things, right? So they said surgery itself, cancer treatment, radiation, where we're frying the tissue, sometimes the cancer itself. So basically, anything that's going to cause swelling and trauma to the area, which we're going to read about in a second. Swelling and trauma to the area is going to have a potential to cause web cording. So this web cording, we know there are these thick fibrous bands. They run all the way down the arm in this area. Now, when we talk about surgery causing this, because that's trauma and will cause swelling, cancer removal surgery, lymph node removal surgery, lumpectomies, liposuction, skin removal, skin tightening treatments, anything, and radiation, anything that's going to traumatize the tissue and cause swelling will have a result of web cording potentially. So looking at breastcancer.org has an article on web cording, and it says researchers are still studying what exactly makes cording happen. Some experts believe that the surgery to the underarm and chest area traumatizes the connective tissue that encases nearby bundles of blood vessels, lymph vessels, and nerves. This trauma leads to inflammation, scarring, and eventually hardening of the tissue. This hardening can spread down the fibers of the connective tissue, which cause the cords to form. More research is needed before we'll know for sure what the cords are made of. So, again, couple things. Swelling. So we know fibrosis. I talk about in my post-op massage and finding a therapist course, I go into the science of fibrosis because fibrosis is inflammation. The process of inflammation is fibro are the proteins that are in your swelling. So fibrinogens, myofibrins, collagen, elastin, and I have all of this laid out in the course for you guys. That course, the link is in the bio, or it's Amare postopacademy.com for you guys to get in there if you want to check out the science of all of this a little bit more and understand how swelling works in the body. So those little proteins are supposed to be floating in your swelling or your lymph fluid. They're in there for a reason. They're there to make tissue, right? So when you have damage to the tissue, your body swells. It brings in your swelling, which is proteins, white blood cells, fats, water, all the stuff to make tissue, right? So lymph fluid is the proteins, white blood cells, fats, and water. In your swelling, you have these proteins, these elastins, collagens, all of these proteins that are meant to make tissue. They're supposed to be swollen and eventually like float down and lay down flat and make perfectly flat tissue. When you have fibrosis, either by dehydration or sheer force on the tissue or more trauma, whatever may cause it, and there's a couple different things. And I'm also releasing a fibrosis course, the science of fibrosis, so you guys can understand fibrosis, how it works, how to stop creating it, and how to reverse it and get your body to process it properly. But with that, whatever the cause of it is, all those proteins get clumped and jumbled and start laying down mismatched and like clumpy and weird and start to cause this big thick like mass. That's kind of the same thing with this web cording, right? So the trauma leads to inflammation. Those proteins come in, scarring, and eventually hardening of the tissue. So it's the fluid becoming dehydrated and thickened and like all bundled, right? Because it says connective tissue that encases nearby bundles of blood vessels, lymph vessels, and nerves. So this swelling is becoming dehydrated, stagnant, crushed, whatever the case may be, and it's wrapping around your connective tissue, causing these cords. That's what this is saying. And then we have the one major thing that we're going to pull from is a medical journal today from the National Library of Medicine, where it talks about what the axillary web cord syndrome is. Okay. Axillary web syndrome, which is also called lymphatic cording, an axillary variation of Mondor's disease, is characterized by a singular or multiple cords of tissue that develop in the axilla, armpit, axilla. Cording may extend further from the axilla to the forearm, usually develops after surgical removal of axillary lymph nodes or sentinel node biopsy in patients with breast cancer. So again, this is more commonly seen in patients with breast cancer, but I do a lot of plastic surgery recovery, not just for breast cancer. Liposuction of the arm, web cording is a thing. If you are having fibrosis after your arm lipo and you're feeling those thick bands, axillary web cord, that's what that is. And this just talks about how it's painful, you lose range of motion, all of that. Let me go back down to the part that I highlighted. Okay. In the literature, AWS, axillary web cording, typically has been reported as a result of axillary lymphadenectomy or sentinel node biopsy patients with breast cancer due to vascular or lymphatic injury. So axillary web cording is part of a lymphatic injury. It has been suggested that surgery can cause lymphatic thrombosis because of the increased lymphatic fluid coagulation during the surgery procedure. What did I just say about the swelling? The swelling starts to thicken, and this is what this is saying, the lymphatic fluid coagulation during the surgical procedure. Now here's the other thing. Lymphatic fluid can coagulate, congeal, thicken your swelling. Lymphatic fluid, congeal, thicken without any inducement, and this coagulation can be stimulated by the existence of plasma proteins called thrombokinesis. I'm saying that wrong. After surgery and tissue injury. So, pause. Surgery and tissue injury. So not just surgery, but radiation, heat, not heat, but like the Renuvion heating of the skin. I usually see a lot of axillary web cording when you guys do get some type of skin tightening done. If it's just arm lipo, it's usually just fibrosis, or it's a flat, hard mass because that fluid is congealing and thickening for whatever reason, multiple reasons, which I explained in the course. But the axillary web cording part of it, I usually see after the body tights, the Renuvions, the skin tightening treatment things. So tissue injury. The levels increase, which may explain the development of AWS after surgical intervention. And then it's just a bunch of more medical stuff that you guys don't need to hear. Let's see if there's anything else I highlighted, and then we can talk about things that we do to get rid of it. And this is all just talking about after cancer, and those are the footnotes. Nice. So with axillary web cord syndrome, it is a version of fibrosis. It is that same hardening, thickening, congealing. Fibrosis is usually presented as little balls or lumps or bumps or like tightness, thickening of the skin and the tissue, because again, that swelling that's supposed to be watery and mobile is now thickening. Axillary web cording is that swelling proteins wrapping around those tendons and connective tissue fibers. Because if you guys look at like your arm already, you'll feel those little like tendons in there, those hard stringy things in there. Axillary web cording, axillary or cording, web cording in general, all that swelling is going to bind up around those tendons and that connective tissue, and it's going to start building up and congealing and thickening. So one of the ways that we handle this is the same way we would handle it after surgery fibrosis, because it's pretty much the same thing. What you want to not do, because it's very painful, is have someone, which you will hear all the time, you gotta break up the scar tissue. This isn't scar tissue yet. It's swelling near lymph nodes, because the lymph nodes aren't there, they're removed, or you had, your plastic surgery done and you're super swollen and nothing's absorbing right now. Do not have somebody try to break or pop or rip your web cords or fibrosis in there, because it's already an inflammatory process. As one of those articles said, it's the inflammatory part of it. This trauma leads to inflammation and eventually hardening of the tissue. It's inflammation. We don't want to add more inflammation to the already hardening inflammation we have inside of you. That is like primary for any fibrosis treatment at all, especially web cording. I know a lot of physical therapists will go in there and like pop the cords to give you guys relief, but you're going to wind up with more swelling. And if the reason that fluid is stagnant is because you don't have lymph nodes anymore in there, or your lymph nodes aren't pumping and absorbing properly because of plastic surgery, and you're still trying to heal because of like liposuction and all the things, your body's not going to be able to process out that inflammation. So you're going to wind up with the same web cording issue or even worse inflammation than before, because that's a band around your connective tissue. It's a hardening and thickening of your connective tissue. So if you're going to go in there and start scraping and rubbing, you're going to cause a lot of inflammation in an already inflamed area, and it's going to build up even more. You may get short-term relief because the cord has popped, but in range of motion, but you're going to be really swollen and inflamed, and it can cause more problems. So what we want to not do is do things that make inflammation worse. So vasodilators, right? Heat, friction, rubbing, things that are going to make you more swollen. We don't want to do those things when we have web cording. What we do want to do is manual lymphatic drainage. So as a CLT, a lymphatic therapist for after cancer and things like that specializes in dealing with all these complicated swelling things, One of the things you want to do is manual lymphatic drainage because, again, several times in all these articles, it's mentioned lymph system, lymph vessels, lymph, all the things. There's something going on with your lymph system that it's not absorbing the swelling properly or the lymph fluid, and then it's sitting there and becoming hard and stagnant and wrapping around your connective tissues. So we want to be doing manual lymphatic drainage. We want to be stimulating your lymph. Now, this is extremely important. After cancer, if you have had lymph nodes removed, you need to find yourself a certified lymphedema therapist, CLT. And I have a resource on our online course page, Amare Post-Op Academy, where I have a downloadable PDF, and you guys can click the links. There's reference links on there. Type in your zip code, and it'll populate several different lists of therapists that you can find. But you need to find a certified lymphedema therapist, someone who knows the lymphatic system, because even after surgery, your lymphatic system is down over here. If you're either missing nodes or after like lipo or after you've cut in here, your body has a lymphatic map that tells it which way fluid needs to flow. And if you don't know what I'm talking about, head over to our Instagram because I have that map on like one of our posts that shows you which way fluid drains in the body, in which directions. You cannot just have someone or even yourself without understanding how the lymphatic system works to remove swelling, just start rubbing away in there and just start moving fluid around everywhere. Because you don't know, if you don't know the map and you don't know what's missing or broken in that map, you're going to be guiding the vessels and stimulating them in a way that it's backing up fluid, making it worse rather than making it better, especially after cancer. It's called decongestive therapy. We don't want you doing congestive therapy where you wind up congesting your system because you don't know which way things are supposed to go or understand the anatomy or understand how to do it. So making sure that you find someone that is trained in this stuff like I am, a CLT, is what you're going to want to do. And if you need help finding someone, go to amarepostopacademy.com. The link is in our bio on our Instagram. It is also in the description box below. And that you'll be able to find that list, get the PDF, go click the links and find yourself a therapist to help with that. But you need manual lymphatic drainage. So this gentle skin stretching movement. Do you see how I'm just placing my fingers on the skin and then moving it? That's all I'm doing. And you can see the skin in my arm move. That's it. You don't want any this thing. You don't want any this. You don't want any rubbing or oil. We don't want any of that. Whether you're after cancer or whether you're after liposuction, arm lift, Renuvion body tight. We're not doing any of that. With web cording, yes, you may feel, if you're doing manual lymphatic drainage and you're getting some looseness, you may feel that pop that they're talking about or that release. If that happens on its own, that's a different story. That is not someone going in there and ripping through your body and breaking cords and then causing more inflammation that your body can't process because it has cords in the first place because it's not processing the swelling. So we don't want to do that. The other thing we do at Amare, now with cancer patients and things like that, it's a little bit different. It depends on what's going on. But after plastic surgery specifically, listen to me guys, after plastic surgery specifically, with web cording and fibrosis, you guys are wearing a compression garment, right? Like a full arm sleeve, little vesty jacket situation with the little snappy things sometimes and the little thing that goes across like this. Yeah, you're wearing one of those. Go get yourself a pack of the Amare lipofoams. Not all lipofoams move lymphatic fluid, but the Amare lipofoams are medical grade polyurethane. That is the same polyurethane that, hey, breast cancer guys, that you guys have in your overnight, either your tribute or like your overnight garment that looks like a giant, there's a couple different brands, but it looks like a giant oven mitt that goes on your arm. That's the same foam that's in there. You guys after plastic surgery, that's the foam that we have. You're gonna wanna get yourself a pack, 3 of those, and you're going to want to take the foam and either fold it in half and put it under where your cords are, or if you have cords like all the way around, one flat sheet. Hold on, wait, let me show you what I'm talking about. This stuff. Now, Fun fact with the foams, guys, oxidization, these will turn yellow when they're exposed to oxygen and used. That's how I know you guys are using them. But in the pack, they are super duper white, super duper nice. That's why these stay closed and sealed, because then they look like this. But you're gonna wanna take this foam, and depending on where you have your fibrosis, you're either going to wrap it around this way in your garment so it's covering, or this way, which is my preferred way, because again, we want to stimulate in that lymphatic area. This is not for after breast cancer. This is not after node removal. This is only after plastic surgery where you guys have healthy nodes. Take a pause real quick. If you have breast cancer, had breast cancer, did radiation, have axillary web cord syndrome after any kind of cancer removal, lymph node removal, sentinel node, all the things for cancer, you need to schedule a virtual with me, because it's not that simple. Because these are stimulating your lymphatics, you may not have parts in there anymore. If you have AWS, Axillary Web Syndrome, after cancer, you need to call my office and schedule a virtual with me. Do not go putting foams anywhere on your body until you do so, until you talk to me. Because again, that lymphatic mapping is super important. We have to be able to make sure we're doing things in the right way. You guys are a very, very different case. But you guys after plastic surgery, because it's the same thing, just two different ways of handling it, your foam, like this, just like that, in your garment. So you're gonna do this, hold it, pull your garment up, pull it this way under it, and then inch it up your arm, back to front, and this will sit in your little arm sleeve jacket. And then you can button up, do your whole thing. And you're gonna do that on both sides. You had both sides done of your arms. There are also other things to do with the foam that's a little bit more advanced depending on your web cording. Now that goes for you plastic surgery guys too. If you have the Amare lipo foams, or if your web cording is like a lot and you have a lot of fibrosis and you're like, oh my God, I don't understand. Or if you had an arm lift and you've got that fibrosis and you're worried about your incisions, call the office and set up a virtual with me, because I'll be able to teach you how to use the foams properly to stimulate your lymphatic system in a certain way to get that to start to resolve. Now, why do the foams work? Foams are used in the cancer community, in the CLT community, for exactly that, for stimulating the lymphatic system, for helping break down fibrosis back to fluid so your body can reabsorb it and you can pee it out. So the foams sit on your skin, in your garment. They don't collapse in your garment. And every time you move, they do this. And they move against your skin. And that helps stimulate the lymphatics to get all of that hardening and thickening of fluid to go back to being soft and squishy. And then your manual lymphatic drainage comes into play, where your therapist knows how to reroute that fluid properly in the body in whatever direction to get it to process, whether you are lipo or whether you are cancer. So that's why it's important to have that therapist. But if you don't, you can set up a virtual with me and we'll see where you're at and see what's going on. But just to sum it all up in a pretty little bow, because you guys know I love my bows, axillary web cording can happen after radiation, cancer removal surgery, lymph node removal surgery, lipo to the arms, skin removal to the arms, body tight Renuvion, heating elements that are used for skin tightening, anything that is going to cause swelling or inflammation directly at the site of the lymph nodes in your armpit is going to have a potential for axillary web cording. Doesn't mean you're going to have it, but have a potential. Axillary web cording can happen anywhere from 2 to 8 weeks after surgery. Now, if you had radiation and didn't have surgery, it can still happen anywhere in that time. It can happen after that. The reason it's happening, it's a lymphatic issue. So the lymphatics are either damaged and not absorbing that swelling and that fluid the way they're designed to, or you just had surgery and you have a massive amount of swelling and your lymphatics aren't being stimulated or keeping up with draining the fluid that's in there. So it's starting to sit in there and thicken and congeal around your tendons, around your connective tissue. or with radiation, it caused it to harden, caused that fluid to harden. With lymph node removal surgery, you don't have parts in there to filter out the swelling, so it's starting to congeal and wrap around that area. With lymphedema, same thing. All of the things, whatever the cause is, swelling and your lymphatics are not working properly to get rid of the swelling that's in there. It's becoming stagnant and thick and congealing, like in the medical journal that we just read, and it's wrapping around the connective tissue. How do we get rid of it? We start getting the lymphatics to move. If you are after liposuction, you need to get the lipo foams so that it can stimulate 24/7 that area and start to get the fluid to go back to a liquid state rather than a hard state. If you are after breast cancer removal surgery, we need to, or any kind of breast cancer situation, lymph node removal surgery, lumpectomy, radiation, all of it, any of that in there, we can do the manual lymphatic drainage. We can still talk about doing the foams. If you're in a compression garment, see what's going on, but that is something you have to set up directly with me. I don't know your situation. I cannot give a generalization for after cancer on how to do a protocol specifically for web cording, because everybody's is different. If you have radiation to your neck for throat cancer, you will get cording because this is a bed of lymph nodes. You will get cording down your neck. You will get cording in here from your collarbone up to like the back of your head, and it will be tight and you won't be able to move. You can get cording on your trunk from your ribs to your hip bone. You can get cording anywhere. There's a potential for it, especially after radiation. It's not as easy to generalize for cancer recovery with cording, but what I can say is cording is something that we can get rid of. After cancer, it's very easy. It does not have to be painful. No one is going to be digging their thumbs through you or popping and ripping your cords. One of the things a couple of these articles do tell you is not to do any like aggressive movement. You want to just gently do range of motion. You're not doing any kind of pulling, ripping, stretching. That's not how these cords are working. It's not like you can just break it up because it's inflammation. So we don't want to do anything that's causing more inflammation. So when you're talking about liposuction, get yourself the foams. Put them in your garment the two ways I just showed you, either front to back wrapping around or horizontal wrapping in your garment, and that's going to help quite a bit. If you still need help with that, if you have the foams and you're using them and you're like, I'm not sure if I'm doing this right, I don't know if this is really working, it's softening but I'm still swollen, that's something you need to set up a virtual with me for, because we either need to find you a manual lymphatic drainage therapist, or there's something going on with your diet or something going on with your garment. There's a million other things to do with that. So if you are plastic surgery and need help with the web cording or any kind of cording that you're having, call the office. If you're after cancer, definitely call the office, because I can do that virtually, but I am also located in Highland Park and Elizabeth, New Jersey. So you guys can come in for me to be your manual lymphatic drainage therapist, as well as help you with the foams and explain everything to you. We're not doing any ripping, rubbing, like craziness to the cords. The cords are inflammation, so we don't want to be doing anything aggressive. I think that's pretty much it for wrapping it all up. If you guys want to learn more about fibrosis, if you have fibrosis questions, the link to purchase the course is on our Instagram. It will also be down in the description box. The course is post-op lymphatic massage and finding a therapist. We are going to be changing the name of the course soon, but I do talk about the 4 stages of wound healing and fibrosis, lymphostatic fibrosis, how it's made, what it is, how it changes form from swelling into fibrosis, things that can cause that you guys want to avoid or, cut back on so that it's not as bad. That link is Amare Post-Op Academy. It's on our Instagram in the bio, and it's going to be in the description box. The link for the lipo foams, you will need 1 pack, 3 foams. That is the Amare, just Amare post-op shop. That link is also in the description box. I will have my scheduling coordinator put the actual link to the foams in the description box for you. But the link to the foams directly is also on our Instagram. It's in our link in bio. It's a picture of it. You click it, you can purchase them right from the link in bio. So whenever you're dealing with fibrosis at all, foams are going to be your number one thing because they are doing that 24/7 lymphatic stimulation to your skin and to your tissues, as well as finding an MLD therapist. That's going to be something that helps you. Oh, that guide, that vetting your therapist guide to help you find somebody that's actually CLT certified, like, or manual lymphatic drainage certified. That is also Post-Op Academy, Amare Post-Op Academy.com. That's also on there. The only two things on that website right now are that course and the PDF. But the link to the PDF guide is also in our Instagram. So you guys can go and get your foams. You can go and get your PDF guide to find yourself a therapist. You can go enroll in the course to learn more about fibrosis, and lymphatics and swelling and massage after plastic surgery and finding and vetting your therapist. All that's in the course. So guys, that's pretty much it. I hope this was helpful and explained it a little bit. Let me just really quick tell you one more time what those articles were. So breastcancer.org treatment-side effects / axillary-web syndrome. That was one of them. The other one is ncbi.nlm.nhi.gov, medical articles. That's easy. If you go to National Library of Medicine and just type in web cording, you'll find a couple different articles on it, pretty short ones too that are really good. And then the little PDF that I have here for the Cancer Care Alberta, albertahealthservices.ca, Axillary Web Syndrome PDF. All of that, if you just Google those names, all of that will come up. Or if you just put in what is axillary web cording into Google, you'll find these exact ones, so that you can, kind of start doing some research on your own. But that is axillary web cord syndrome, or web cording. It does not just happen in your axillary armpit area. It can happen here, in your neck, into your collarbone. It can happen on your abdomen. It can happen in your hips. People don't realize this. If you are having lymph node removal or inguinal hernia repair or anything that's going to mess with the lymphatics of your inguinals and your hips, like your hip crease, you can get web cording in there pretty bad. You can also get it on your pubic region and your abdomen. It can span from hip to hip and be like thick bands. That's also another thing. So it can really be anywhere. It's web cording. It's not just axillary, but it's most commonly known to be found after breast cancer, axillary. So I will post a picture of that also so that you guys are aware of what it is. Maybe with like some links to these articles on my Instagram. That'll go up the same week this video does. So guys, if you need to schedule with me, call the office, 732-841-0142. Happy Alex, scheduling coordinator, will be happy to set you up with an appointment with me. She can answer questions about scheduling, but related to this stuff, guys, you have to see me directly, especially if you're post-cancer. You have to see me directly, either virtually or in person. Because that's a very, very individualized thing. And then same thing after plastic surgery. You can get the foams, you can put them in, you can use them. And if it's working, but it doesn't seem like it's enough, like you're a little bit farther along of a case with your fibrosis, or just something's not right and it's not working, and you already have the foams, that's also going to need to be a virtual. Sending us pictures on Instagram, I can't do anything with because I need to actually talk to you and find out what's going on. Sending us emails and text messages, same thing. So if you have questions about how to use the foam more than I explained in this video, or in the video that I have on the product page for the foams, or if you have questions relating to your axillary or web cording or fibrosis situation in general, that's something you need to see me for. So call the office, 732-841-0142. Check out that online course because that explains a lot about the fibrosis stuff in there. And I will see you guys soon. I hope this was helpful. Ashley with Amare. Bye.